Hello, thanks everyone for joining us today. My name's Rick Allgeyer, and I am the research director at the Oregon Center for Nursing, and we're going to talk about the impact of the COVID-19 on employment of registered nurses in Oregon. A little bit about us first. The Oregon Center for Nursing was formed in 2002 by a group of nurse leaders here in Oregon to deal with some of the workforce issues that were happening at the time. OCN facilitates research and collaborations for Oregon's nursing workforce to support informed, well-prepared, diverse, and exceptional nursing professionals. We conduct, analyze, and disseminate research, encourage collaboration and build partnerships with diverse stakeholders, and promote nursing and healthcare in all settings in which nurses practice. So a little bit about the study we did. In the very early parts of the pandemic, Governor Brown declared a state of emergency on March 8th through Executive Order 2003. On March 17th, Governor Brown issued Executive Order 2010 with the intent to conserve personal protective equipment, PPE, and hospital beds. Executive Order 2010 also ordered that all elective and non-urgent procedures across all healthcare settings that utilize PPE be canceled or rescheduled no earlier than in June. Executive Order 2010 also encouraged other industries that utilize PPE to cancel or postpone non-essential uses of PPE during the ongoing state emergency. So the study question from those executive orders was, due to the cessation of elective and non-urgent procedures, many healthcare settings severely limited the care they provided or closed temporarily. These limitations and closures likely affected the nursing workforce across Oregon, with the potential of nurses being laid off or furloughed. This study sought to look at the impact of those limitations of the cessation of elective and non-urgent procedures on the nursing workforce. In order to gather the data, OCN had to work with the Oregon State Board of Nursing and the Oregon Employment Department to examine employment department records on employment status of registered nurses practicing in the state. OED pulled employment records for about 35,000 nurses practicing across various healthcare settings. We pulled data for 4 quarters, the fourth quarter of 2019 through the third quarter of 2020. These data were analyzed on a quarterly basis, and all comparisons are made across quarters. The number of RNs employed by practice setting, or in some cases setting group, which we'll talk about, for each quarter, and the percent change quarter over quarter are reported. So basically what we were looking at is the number of, so this is the graph of all healthcare and social assistants. So this is everybody who works in healthcare or social assistant and is looking specifically at registered nurses. And the impact is going to take place in the second quarter of 2020. Even though the executive order was signed during the first quarter, it happened really, really late in the first quarter. And so the impacts that we're going to see all really happen in the second quarter. So this is healthcare and social assistance. What ended up happening during the second quarter was employment dropped by almost a full percentage point. It dropped by 0.9%. And it started to rebound a little bit in the third quarter. So this is an overall look of everyone who works in those settings, of all the nurses who work across all healthcare settings. And now we're going to look specifically at specific settings. So the first one we're going to look at is physician offices. And as you can see, we saw a big decline in this due to the executive order. A lot of physician offices closed temporarily or really limited the amount of services they were providing. So during the second quarter of 2020, the number of employed nurses dropped by 2.2%. It jumped in the third quarter of 2020 by 0.1%. So it started to rebound and almost, not quite, but almost close to pre-pandemic levels. This is for offices of dental and other health practitioners. This is one of our settings groups. And we saw a slight increase across the quarters. So we really did, in this instance, we didn't see a whole lot of movement across over time due to the executive orders. But keep in mind, this is also a very small number of nurses working for these providers. Outpatient care centers got hit really hard. These procedures that take place in these centers typically do use a lot of PPE, and these are outpatient centers where people can get services in lieu of going to the hospital. In the second quarter of 2020, employment of registered nurses dropped by 4.3%, and it picked up quite a bit of, it gained quite a bit of employment in the third quarter. It's not quite back to pre-pandemic levels, but it jumped significantly. So outpatient care centers took a big hit during that quarter, and fortunately, it rebounded fairly quickly. Home health was also another provider or another practice setting that took a pretty good hit. In fact, employment dropped by 2.1% in the second quarter of 2020. It really rebounded by the third quarter of 2020. It jumped up by 5.3%. And we don't know exactly what was going on here, but we do know that nursing homes were the sites of a lot of COVID infections, and so they still had they were limiting visitation. They were really locking down those facilities, and so what we kind of think was happening is a lot of people that would typically might be going into one of those facilities postponed their stay, stayed home, and required home health care, especially starting in the third quarter as that first wave of the pandemic proceeded past us. So that's something we're really looking at right now. This isn't a small number, but they have surpassed in the third quarter of 2020, they have surpassed their pre-pandemic employment level. This is this is the general medical and surgical hospitals. They did see a slight decrease in the second quarter. It dropped 0.6%. Unlike all the other healthcare settings, this also has continued to drop in the third quarter. And as we've probably seen in local media, that hospitals are still struggling to retain enough nurses. They're resorting to travel nurses and a whole lot of other things. But we're still continuing to see employment in the hospitals drop over time. We have a couple papers on our website that look at what the post-pandemic world's going to look like for the nursing workforce, and we have some ideas about what's going on there with stress and burnout and those kinds of issues. So this is still impacting the medical and surgical hospitals, and it continues to impact those hospitals through the day. Nursing facilities saw another fairly good sized decline during the second quarter of 2020. Employment of RNs dropped by 3.1%. They did go down a little bit in the first quarter. They went down 1.2%. We're not 100% sure what was causing those issues, but the second quarter, the big drop of 3.1%, and it rebounded fairly well. They jumped 1.6% in the third quarter of 2020, not quite back to pre-pandemic levels, but pretty close. I think we're off about 40 or 50 nurses to make us pre-pandemic levels. This is the residential care facilities with on-site nursing. These would include rehabilitation centers, substance abuse and mental health centers, and assisted living facilities. This does not include skilled nursing. Interestingly, we saw an increase during this section, which could be a result of it. And in fact, it jumped 1.8%. And this could be a result of the lockdowns of the nursing facilities that folks were looking for other sources of care during this time as the nursing homes were really locked down. We're looking into this a little bit carefully because this jump is a little counterintuitive. And so we're trying to understand exactly what was kind of going on during this period of time. So that is the data slides. So basically, overall, employment of registered nurses dropped by about 1% during the second quarter. Physician offices, outpatient care centers, home health, nursing care facilities saw larger declines of between 2 and 4%. The number of nurses employed by other types of residential care facilities showed some growth during this period. And with the exception of hospitals that we talked about earlier, most settings saw decreases in the second quarter were recovering or showed signs of recovery by the third quarter. The number of RNs practicing in hospitals declined by as we talked before, by 0.6% in the second quarter, and the drop continued in the third quarter by another 1.3% of a decline. But I want to give you a couple things. So one of the things you may have noticed is that we had not talked about unemployment rates. We were just talking about the number of nurses employed. And that's because we have some limitations with the data. The way the Oregon Employment Department pulled the data for us, in order to be counted as being unemployed, you had to be unemployed for a full continuous quarter. And we felt that grossly underestimated the impact of the nurses, and that the employment numbers, although they are somewhat attenuated by the way the data were pulled on full quarter employment, it was probably much more sensitive to small changes over time than trying to look at an employment rate or an unemployment rate where a nurse had to be unemployed for the quarter. So that's why we were focusing on the employment numbers. They did show some small changes. And again, remember, when we're talking employment numbers, a couple tenths of a percent point over month or quarter over quarter is a fairly good sized change. So we did see some massive changes during the second quarter as organizations kind of halted providing services to preserve PPE. So these results indicate the efforts to conserve PPE in hospital beds negatively impacted the nursing workforce. The magnitude of the reductions were different across settings, but most settings showed similar patterns. The fact that it was different across settings wasn't surprising to us. Body of work that we're working on currently and have been for the past couple of years has been an idea of maldistribution. It's the basic tenet is we don't necessarily have a shortage, but we do have we have nurses that are just in the wrong place. That they are not distributed evenly across the state, so like rural parts of the state, and in some settings like nursing facilities and those kinds of places, public health, have a very difficult time recruiting and retaining nurses, where other settings, such as a hospital setting, typically don't. So that's kind of why we settled on this, and we weren't surprised by the differences in settings, and that's why we were looking across settings to see where those impacts happened. For the most part, the reduction in employment of nurses was short-lived, with many settings experiencing growth during the third quarter, hospitals being the exception. There are quite a bit of information out suggesting some of the other factors that are present in the hospitals that are leading to the decline, and most of those revolve around stress and burnout and things like that. As the pandemic continues, evidence indicates hospitals and other healthcare settings are still struggling to retain their nursing workforce. Many hospitals and other settings that we typically don't see use the travelers have started to use travel nurses to augment their workforce. So we think what's going on now, the processes that are governing turnover among healthcare workers now is really different than it was early on in the pandemic. Early in the pandemic, we were healthcare organizations and us were trying really hard to preserve PPE. We knew we had PPE shortages. You heard stories of nurses wearing masks all day during their shifts. And so this executive order was specifically specifically designed to limit the utilization of PPE and to preserve it for the hospitals that were dealing with a massive influx of COVID patients. And so that's really different than what's going on today, where the increasing levels of stress and burnout as the pandemic continues is especially broad, especially among nurses practicing in hospitals. There is evidence to suggest that the pandemic was the shock to the system, causing nurses to rethink their future employment plans. And obviously more research is necessary to understand the breadth of and the processes leading to this increased turnover among practice settings, in all settings, and especially hospitals. So if you have any questions, here's my contact information. It's rick.allgeyer at oregoncenterfornursing.org, oregoncenterfornursing.org. You can also check our website to find recent studies that we put out looking at what we think is going on during the later stages of the pandemic. So thank you very much, and have a great day.